Joining us now is Danielle Darby with RCM of Washington. And Danielle, I guess the best way to introduce you would be to say that there are heroes out here on the front lines of this coronavirus that people don't even see. Give me an example of how you guys are working to basically keep a lot of people safe.
Sure. So RCM supports about 100 people residentially. And to keep those folks safe out in the community, most of them live in supported apartments, some of them live in group homes, some will still live with families, but we employ about 275 direct support professionals. And what those people do day in and day out is they come to work and they do everything from activities of daily living, which include maybe they're cooking for folks, they're cleaning for folks, they may be bathing, they may be assisting with meal prep, they may be brushing teeth, they may be assisting folks that need help with eating. So they're doing physical therapy plans that have been outlined. They're doing occupational therapy plans. They're doing speech therapy plans. So they're doing a lot of work for very little pay.
All of us who have had parents who were seniors, and in my case passed away, which is the reason that I'm referring to them in past tense, know exactly what you do. And I think what bothers me when I hear all this discussion about PPM, or PPE rather, is the fact that they're not recognizing that you don't have a choice when it comes to social distancing. Explain why.
Exactly. We have no choice. Most of our folks that we support, first of all, don't understand what social distancing even is, right? So when folks are coming to work, we are helping them possibly get out of bed. So we may be physically lifting them. There's no option to do anything else. So we have no choice but to come in close contact with people. Hence why PPE is so important. I think on a daily basis, we have people coming in and doing things that they would do at home, but they're getting paid here at RCM to do the exact same thing, right? And so I think it's so important, because social distancing to you and I are fine. We understand what it means. But when they're coming in, they're wearing masks. And in some cases, they have to wear gowns. And so people don't even recognize who these people are, right? So they're used to seeing somebody come in on a daily basis. They know what they look like. They know what their voice is. But things are distorted now. We're wearing masks. So your voice is distorted behind that mask. They don't even know what you look like because the mask is covering the majority of your face. And so it's very scary in some instances as well.
How concerned are your employees about the two-way street of coronavirus? In one sense, there's the possibility that they may be taking the virus into some place that would be vulnerable. In the other sense, they may be walking out of that same place if they don't have the proper protection, exposed to coronavirus.
Sure. My staff are terrified. I have had many of them, probably to date, at least 30 to 40 of them, call me and say, I just can't work right now. I have an elderly mother that I'm taking care of at home, or I have children at home that I can't risk bringing this virus home to. And so I just need a break. I need to walk away. Can I use my leave? In most cases, people don't even have leave. We have a lot of part-time employees that don't even have leave. So, and if they're choosing to leave, not because they're sick or they're taking care of a sick one at home, the CARES Act 2-week pay doesn't even qualify them for that. So it's kind of a catch-22 that people are scared. Now, we do have quite a few folks coming to work, but our big fear at RCM is probably about 70% of our direct support professional workforce have more than one job. So not only are they working for RCM of Washington, they're working for, agency A over here or B over there. And so we don't know what those agencies are doing and how they're protecting their employees. So we don't know what they're doing at their other jobs. They may be doing direct care. I mean, we have employees, specifically nurses, that work in hospitals, that work in long-term care settings, that work in the DC jail system. We have direct support employees that work in the DC jail system. And at hospitals as possible CNAs. And so we don't really know what people are doing outside of their time here at RCM. So it's very scary.
One final question before I let you go, and that is, if Congress is listening, what do you want them to hear? What do you want? What's the message?
We want them to hear many things. We are essential. Direct support professionals are essential. We want them to know that we need frontline testing for our employees. When we have a positive test, we need to be able to test the rest of the people that live in the home. We need to ensure that staff are safe. We need PPE. We need to know that this is not a minimum wage job. Right now, we are only 65 cents off of minimum wage here in DC. And in July 1st, which is a very short time, we will be a minimum wage job. This is not a minimum wage job, and we need support from our Congress, from our local, from our mayor's office. The city council in DC has been great. They passed an act that would give direct support professionals an increase. We need that funded here in DC. So those are some of the things that we need here in DC.
Danielle Darby with RCM. I want to thank you for being with us this morning. Danielle, thanks.
Thank you very much. Have a great day.
You too.